Hello, everyone. My name is Tomilola Musari-Martins. I'm a senior medical officer at the Clinical Sciences Department, Nigerian Institute of Medical Research, Lagos, Nigeria. On behalf of my research team, I'll be presenting evaluating the preparedness of child health facilities and healthcare providers to COVID-19 pandemic. Diagnosing SARS-CoV-2 infection in the pediatric population comes with a number of challenges, including the mild nature of the disease, the similarity of symptoms of COVID-19 to common childhood illnesses, and the possibility that these children could be silent transmitters to their family members and healthcare providers. These challenges raises the doubts on the level of preparedness and awareness of child health facilities and healthcare providers in adopting measures to combat the COVID-19 pandemic. Our study evaluated the preparedness and response of healthcare facilities and healthcare workers in pediatric settings to the COVID-19 pandemic. It was a cross-sectional study involving pediatric healthcare facilities and the personnel that work there. We utilized an online questionnaire to evaluate the preparedness of the management of infectious disease outbreak as typified by COVID-19. The information we called included demographic characteristics of these health personnel in hospital providing care for children, infection control practices, knowledge, and the preparedness for prevention of COVID-19. The data we generated was analyzed using SPSS version 23. Majority of our respondents were medical doctors who had had greater than 5 years medical practice experience. Most of them also were in public healthcare service. 68% had existing infectious disease units, and 60% had an existing policy on disease outbreak. Most of the facilities had fair rating of the AIPC policy and facility support. With respect to COVID-19, majority of the respondents had good knowledge on the cause of COVID-19 and the incubation period. Most of the respondents were aware that the disease could be with or without symptoms and could mimic other childhood illnesses. About 55% of the facilities had fair rating of their policy strength at combating this disease. The reason why most of the healthcare facilities had existing infectious disease units with relatively good healthcare policy is that most of them were secondary and tertiary levels of care. This is in contrast with earlier reports of poor preparedness of healthcare facilities in Nigeria, Uganda, and other places. The report of fair rating, despite the existence of policy, however, is in concordance with previous works. This further buttresses the fact that a standard IDU is not only about the existence of policy, but the availability of the resources and the training of the healthcare workers to operationalize the policy. Furthermore, most of the participants showed a good understanding of the steps in infection prevention and control. This could be alluded to their years of medical experience, and in addition, the facilities were predominantly secondary and tertiary. The findings is similar to reports in previous works that demonstrate the knowledge and competence of healthcare workers on infection prevention and control. The value of a good overall knowledge of healthcare workers is significant in all spheres of disease identification, control, and management. The knowledge of healthcare workers about the spread and symptoms of SARS-CoV-2 infection was found to be high, and this could indicate their level of clinical experience and their need that they had found to keep abreast of information during disease outbreaks that had occurred in the past, such as Ebola, cholera, Lassa fever in Nigeria, and also the current global pandemic of COVID-19 disease. However, only 57% of the healthcare workers were aware at the time of the study of the diagnostic criteria due to the novelty and the non-specificity of the disease. The fair assessment of facility preparedness expresses the continued need for healthcare facilities to provide universal precautionary measures and control programs, disease surveillance, and human resource development to combat the current pandemic or any other epidemic in the future. This is in concordance with previous research depicting similar ratings of facility preparedness towards outbreak of communicable diseases. Our finding shows the need for healthcare facilities to continuously evaluate their preparedness towards present and future epidemics. Our study was limited by the online nature of the assessment. It was a cross-sectional study, and we used it to evaluate the preparedness of healthcare workers and healthcare facilities dedicated to children. In addition, the views of the parents and caregivers about the capacity of the healthcare personnel and the facilities were not assessed in this study. In conclusion, there is a need to harmonize infection control practices and the activities in pediatric healthcare institutions through routine and refresher trainings, creating and updating guidelines, developing capacity, monitoring and evaluation, as well as management of COVID-19 cases and other epidemics in the pediatric population. This will ensure optimal standards in various institutions. Thank you very much for listening. I want to use this opportunity to thank the BSI conference team for the opportunity to present. My team and I appreciate the opportunity, and it is well appreciated. Thank you so much.